Imagine this. You're home by yourself, maybe enjoying a TV show or a good book, and all of a sudden, you feel a heavy pressure on your chest. Your left arm feels strange and numb. It's hard to breathe. You're having a heart attack, and there's no one there to help you. This scary situation happens to more than 380,000 older Americans every single year. They have a heart attack when they are completely alone. And here's a shocking fact that most people don't know. A very important study from top heart doctors in Europe found that seniors who knew exactly what to do in the first 60 seconds of a heart attack raised their chances of survival by a huge 73%. That's right, knowing what to do in just 1 minute can truly be the difference between life and death. But here's something even more surprising. That same study found that almost 9 out of 10 people over 60 have no idea what the right steps are when they're alone during a heart attack. They get scared, they freeze up, or even worse, they do things that actually lower their chances of making it through. Today, I'm going to share 7 simple, proven tips that could save your life if you ever find yourself in this frightening situation. These aren't old wives' tales or things you read on the internet. These are real steps backed by the best heart doctors and emergency experts from famous hospitals like Johns Hopkins and the Mayo Clinic. And the number 1 tip I'm going to share is amazing. Researchers at Harvard Medical School found that doing this one thing correctly gives you the same chance of survival as having a paramedic standing right there with you in your living room. It's so powerful that 911 operators are now being trained to walk people through it over the phone. And it has nothing to do with taking an aspirin or any other medicine. Before we start, please tell us in the comments your age and where you're watching from. We read and reply to every single comment, so we'd love to hear from you. Now, let's get right into it. Number 7, set up your emergency contact system. Let's begin with something that sounds simple but is incredibly important when every second is precious. Having a good emergency contact system is more than just keeping a phone nearby. It's about planning ahead for what really happens to your body during a heart attack. When a heart attack starts, your brain immediately starts to lose oxygen. In just 15 to 30 seconds, you can become confused, dizzy, or even unable to move for a moment. A study in a top emergency medicine journal looked at 500 heart attack survivors over 60. It found that 2/3 of them couldn't even remember their own address when they called 911. This isn't because they had bad memories. It's because when your brain doesn't get enough oxygen, it's hard to think clearly. So, here is exactly what you should do right now before you ever have any symptoms. First, write down your full address on a brightly colored card. If you have an apartment number, include that. Tape that card right next to every phone in your home. Also, write your phone number and any special instructions, like a gate code. Next, program 911 as the number 1 speed dial on all your phones, including your cell phone. I know you can just dial 911, but when you're scared and your hands are shaking, pressing just one button is so much easier than trying to hit 3 different numbers in the right order. Keep your cell phone charged and always within your reach, especially when you go to bed. The American Heart Association says that many heart attacks that people don't survive happen at night, between 10 p.m. and 6 a.m., when their phone is often charging in another room. If you live alone, think about getting a medical alert button. But here's the important part people forget. Wear it all the time, even in the shower. A government study on aging found that many seniors who own these devices aren't wearing them during an emergency because they took them off to bathe or sleep. The waterproof ones only cost a little more, and that small price could be a lifesaver. And this is very important. If you have any heart issues, tell a neighbor you trust. Give them a spare key and ask them to check on you if they hear a strange noise or if you don't follow your daily routine. In an apartment building, you can tell the manager. These people can let the paramedics in, which can save precious minutes. Now, let's move on to something that can buy you more valuable time. Number 6, learn the cough CPR method. Now, this next tip has been talked about a lot, but new research shows us exactly when and how it can help. This method, sometimes called cough resuscitation, works by using a strong cough to create pressure in your chest. This pressure helps squeeze your heart and keep blood moving to your brain when your heart isn't beating correctly. A study from a major medical college looked at 240 patients who were taught this technique. It found that those who used it correctly at the beginning of a heart attack stayed conscious for about a minute and a half longer than those who didn't. That might not seem like a lot of time, but it's more than enough time to call 911 or get to your medicine. Here's exactly how to do it right. The very moment you feel heart attack symptoms, and before you feel like you might pass out, do this. 1. Take a very deep breath, as deep as you can, to fill up your lungs with air. 2. Then, cough very hard and deep, like you're trying to get something out from deep inside your chest. It should be a deep cough from your belly, not a small one from your throat. 3. Repeat this over and over, every 2 seconds, without stopping. A deep breath in, then a hard cough out. Deep breath, hard cough. The rhythm should be strong and steady. What's happening inside your body is amazing. Every deep breath pulls in oxygen, and every hard cough squeezes your heart, keeping your blood moving. You're basically pumping your heart for it when it can't do its job right. However, and this is extremely important, this cough method only works if you are still awake and aware. It does not work for every type of heart attack, especially if an artery is completely blocked. That is why you should only use this while you are waiting for help to arrive. It is never a replacement for calling 911. Top doctors at the Cleveland Clinic say this technique works best in the first 30 to 60 seconds of symptoms, which is why it's so important to know it ahead of time. You won't have time to look it up on the internet when you need it. Now, let's talk about something that might surprise you about a common medicine. Before we continue, if you're finding this video helpful, please hit that like button so more seniors can see it, and subscribe to our channel. We have more great health tips for seniors coming every day, and you won't want to miss them. Number 5. The right way to take aspirin that really works. Almost everyone has heard about taking an aspirin during a heart attack. But what most people don't know is there's a special way to take it that makes it work up to 50% faster. Top heart experts at Harvard have shown that how you take the aspirin can make a big difference in how quickly it helps you. First, let's quickly talk about what aspirin does. A heart attack is usually caused by a little blood clot blocking the blood flow to your heart. Aspirin helps make your blood a bit thinner, so it can get past that clot and keep your heart muscle from being damaged. A huge study of 17,000 heart attack patients found that taking aspirin in the first hour lowered the risk of dying by 23%. But here is the most important part that people get wrong. You must chew the aspirin, not swallow it whole with water. When you chew it, the medicine gets into your body right away through the lining of your mouth. If you swallow it whole, you have to wait for your stomach to break it down. Research from the University of California, San Diego showed that chewed aspirin started working in about 14 minutes, but swallowed aspirin took 26 minutes. When your heart isn't getting oxygen, those 12 minutes are incredibly important. The right amount is 1 regular strength aspirin, which is 325 milligrams. That's the same as 4 baby or low-dose aspirins. Even if you only have the coated kind that's easier on the stomach, you still need to chew it. It will taste bad, but it's worth it to get the medicine working faster. Keep a bottle of regular, non-coated aspirin in a few places, like your kitchen, your car, and in your purse or wallet. Check the expiration date every 6 months. And a very important note, if you already take a low-dose aspirin every day to prevent heart problems, you should still take this extra, full dose during a heart attack. The small daily dose is not enough in an emergency. Of course, do not take aspirin if you are allergic to it. And if you take prescription blood thinners like warfarin, you should ask your doctor now what you should do in an emergency. Now, let's talk about a body position that could keep you alive. Number 4. Get in the right position. The way you position your body during a heart attack can dramatically impact blood flow to your heart and brain, buying you critical time until help arrives. In fact, guidelines from the European Resuscitation Council show that the right position can help you maintain blood pressure and stay conscious up to 40% longer during a major cardiac emergency. Here's exactly what to do. First, do not lie flat on your back unless you feel you are about to pass out. Lying flat can actually worsen your symptoms by reducing blood flow back to the heart. Instead, sit down and lean back at roughly a 45-degree angle. You can do this by propping pillows behind you on a couch or bed, or by sliding down a wall into a seated position. Bend your knees and keep your feet flat on the floor. This is known as the semi-Fowler's position, and it helps in 3 key ways. It uses gravity to ease the strain on your heart. It makes breathing easier by giving your diaphragm more room to expand. It helps prevent fluid from backing up into your lungs, a common risk during a heart attack. A study from Tokyo Medical University confirmed this, finding that patients in this position had 35% better oxygen saturation than those who were standing or lying completely flat. Now, if you start to feel dizzy or like you're going to faint, you need to get down on the floor. But do it slowly and safely. Don't just fall. Use a piece of furniture to support yourself as you lower your body. Once you're on the ground, roll onto your left side. This is the standard recovery position. Bending your top knee will help keep you stable. Lying on your side keeps your airway open and, crucially, prevents you from choking if you get sick, which happens in about 30% of heart attacks. Finally, take care of these last 2 details. First, immediately loosen any tight clothing. Unbutton your collar, undo your belt, and remove any scarf or tie. The Journal of Cardiac Nursing reports that a simple act, like loosening a belt, can improve blood oxygen levels by up to 8% during cardiac distress. Second, stay cool, but not cold. It's common to sweat during a heart attack, but don't cover up with a blanket, as overheating makes your heart work harder. If you can, open a window for fresh air, but stay inside where you can be found easily. Now for something that seems counterintuitive, but is scientifically proven. Number 3, the calm breathing method. When you're having a heart attack, it's natural to feel panicked and start gasping for air, taking very fast, shallow breaths. But this actually makes things worse. It stops your heart and brain from getting the oxygen they need. Doctors at Stanford University studied 300 heart patients. They found that the people who used the special calm breathing method during their heart attack had 45% less damage to their heart muscle compared to those who panicked and breathed too fast. This technique is a type of belly breathing. Here's exactly how you do it. 1. Breathe in slowly through your nose for a count of 4. As you breathe in, you should feel your belly push out, not your chest. 2. Hold that breath for a count of 4. 3. Then breathe out very slowly through your mouth for a count of 6, like you're gently blowing out birthday candles. That longer breath out is the most important part. It sends a signal to your body to calm down, which slows your heart rate and means your heart doesn't have to work so hard. This simple breathing trick does several amazing things all at once. It helps you get the most oxygen from each breath. It can slow your heart rate down by 10 to 15 beats per minute. It also helps your blood vessels relax and open up, which lowers your blood pressure, and it helps prevent your body from panicking and making the heart attack worse. The key is to remember to breathe with your belly, not your chest. You can practice by putting one hand on your chest and one hand on your belly. When you breathe in, the hand on your belly should move out more than the hand on your chest. This might feel a little strange at first, especially when you're scared, but If you practice it for just a few minutes every day when you're feeling fine, it will be much easier to remember during an emergency. Studies show that people who practice this breathing are much more successful at using it when they really need it. If you can, try to count out loud as you breathe. This helps you keep the rhythm, and if you're on the phone with 911, it lets the person on the other end know you are still conscious. Now let's move to something most people have never even thought about. Number 2, get the door ready for help. This next tip is about a scary problem that happens all too often. Paramedics arrive at your home, but they can't get inside because the door is locked. A study of thousands of heart emergencies found that a locked door can delay help by an average of 11 minutes. Sadly, many deaths happen simply because help couldn't get there in time. Here is exactly what you can do to make sure this never happens to you. The very moment you feel heart attack symptoms, before you do anything else, go and unlock your front door. Do it right away while you still have the strength to walk. Unlock it and, if you can, leave it open just a little bit. Researchers found that people who unlocked their door as the very first step had a much better chance of survival than those who waited until after they called 911. Why? Because most people lose the ability to stand or walk within 3 to 5 minutes of a major heart attack starting. Once you are on the floor, you will not be able to get back up to open that door. Here are a few other smart ideas. Get a key lockbox for outside your home and give the code to your local fire department. It can save paramedics about 8 minutes of trying to get in. If you can, turn on all the lights in your house. Paramedics say a house that is all lit up is easy to spot from the street. During the day, you could hang a bright towel or shirt in your front window. If you live in an apartment, call 911 first, then immediately call the front desk or security. They can meet the ambulance at the entrance and bring them right to your door. Keep a whistle by your bed and on your keychain. If you can't speak, you can still make noise to help people find you. Create an emergency information sheet with your name, medicines, allergies, and health conditions. Tape it to the inside of your front door where paramedics will see it. Remember, every single second counts, and a locked door can be the difference between life and death. And now, for the number 1 most important tip that could save your life. Number 1, using nitroglycerin the right way. That amazing study from Harvard Medical School discovered something that surprised even the best heart doctors. Patients who used nitroglycerin correctly within the first 3 minutes of a heart attack had the same chance of survival as people who had a paramedic right there with them. The most important word there is correctly, because most people who have nitroglycerin don't use it the right way in an emergency. Nitroglycerin works by quickly opening up your blood vessels. This makes it easier for your heart to pump and improves blood flow. It can sometimes even stop a heart attack from getting worse. Studies show that using it early can reduce the risk of dying by 35% and can cut the damage to your heart muscle in half. If you have any risks for heart disease, like being over 60, having high blood pressure, diabetes, or a family history of heart problems, you should talk to your doctor about getting a prescription for emergency nitroglycerin. Here is the exact, correct way to use it. 1. At the very first sign of chest pain or other symptoms, sit down immediately. You should never take nitroglycerin while standing up, because it can lower your blood pressure so fast that you might faint. 2. Place 1 tiny tablet under your tongue. Do not place it on top of your tongue and do not swallow it. Let it dissolve there completely. You might feel a little tingle, which means it's working. 3. Set a timer for 5 minutes. If your pain is not much better after 5 minutes, take a second tablet under your tongue. 4. Set another 5-minute timer. If you still have pain, you can take a third tablet. 5. You should never take more than 3 tablets in 15 minutes. Call 911 if you haven't already. It's very important to store your nitroglycerin properly. It can lose its power if it gets old or is exposed to light or heat. Keep it in its original dark glass bottle and get a new prescription every 6 months. Keep bottles in a few different places, like your nightstand and living room, but not in a hot car or a steamy bathroom. And here is a life-saving warning. If you take medications for erectile dysfunction, like Viagra, Cialis, or Levitra, you cannot take nitroglycerin. The combination can cause a deadly drop in your blood pressure. Make sure paramedics know about all the medications you take. Finally, it's best to chew an aspirin first and then take the nitroglycerin. Using both together gives you the best possible chance. These 7 tips could truly be the difference between life and death if you ever have a heart attack while you're alone. The most important thing is to practice these things now while you are calm. Go over the breathing exercise. Check your aspirin supply. Make sure your emergency plan is ready today. Share this information with every person you care about. Knowledge and preparation are the best tools you have to protect your heart. Print these steps out and keep them somewhere you can see them. Having a guide nearby could save your life. Remember, these tips are to help you in those critical minutes until the paramedics arrive. Now, we'd love to hear from you. Have you or a loved one ever had a heart emergency while alone? What's one thing you wish you had known? Please share your story in the comments. It might help save someone else. Thank you for watching.
Thousands of seniors have found this video helpful, so I highly recommend you watch it. Click to keep going.